Please see full important safety information at the end of this video.
Welcome back, Jana. You're looking better today. I remember the last couple times you haven't looked so great.
Yeah, oh my gosh, this the first trimester was so hard. I mean, as you know, I was sick with Jolie too, but this time around, I just felt like I couldn't function at all, and it was really hard because I felt like I also had to take care of a toddler, and I also knew that if I didn't tell you about my morning sickness, that it can actually get worse. Is that right?
True, very true. Better to tell us early on, because the earlier we find out, the earlier we can get to remedies to help you. And usually we don't like to start with medicine. We like to start with simpler things like lifestyle changes, dietary changes. Space out your meals, take a lemon or a lime and massage it in your hand. The aroma tends to make people feel better. Pressure, like acupressure, acupuncture. Ginger is another thing that we try.
I've honestly tried everything, but my morning sickness was still so bad.
Yeah, I remember that. The truth is that when these things don't work, we turn to medication, and we have an FDA-approved medication, safe and effective, called Bonjesta. It's doxylamine succinate and pyridoxine hydrochloride, and it's come to battle for you, and it's doing a good job.
Yes, it is. I'm just so fortunate that I've had the option to take Bonjesta because it's worked so well for me, but I was just curious because in my last pregnancy, I took Duchesnay. So why did you get me on Bonjesta?
Well, like Duchesnay, Bonjesta is an FDA-approved prescription medication indicated for the treatment of morning sickness when diet and lifestyle changes fail. And they didn't work with you, so we moved on to Bonjesta. In fact, Bonjesta contains the same combination of ingredients as Duchesnay, but Bonjesta comes in multi-layer, extended-release tablets that are designed to provide rapid and continuous relief of morning sickness symptoms throughout the day and the night.
I just love the fact that Bonjesta has an easier dosing schedule, because with Duchesnay, you know, you can take up to 4 pills, and then I'd forget some. With Bonjesta, it's only 2, so I just seem like it's a lot easier for a busy mom.
No, you're spot on. Lots of busy moms like you appreciate Bonjesta's simpler dosing schedule. With Bonjesta, you start with just 1 tablet at bedtime. If 1 tablet is enough to control your symptoms, you continue to take 1 tablet every night at bedtime. If your symptoms persist the following day, you increase your daily dose to a maximum of 2 tablets. 1 tablet in the morning, 1 tablet in the evening.
Obviously, I know that you would never prescribe anything that is not safe for me and my baby, but how do you know that Bonjesta is safe and effective for both of us?
Well, a combination of ingredients in Bonjesta has been prescribed for over 60 years and has been used by over 35 million women worldwide for the safe and effective treatment of morning sickness. Results of controlled studies have shown no increased risk to an unborn baby during pregnancy. You can also rest assured knowing that ACOG, the American College of OB-GYNs, recommends the combination of ingredients in Bonjesta as first-line pharmacotherapy for morning sickness when non-medicinal treatments don't work.
So I've been telling a lot of my friends about Bonjesta and how it got my morning sickness under control, and a lot of my friends have been asking if it's suitable for women with dietary restrictions.
You can assure your friends that Bonjesta is suitable for women with both medical and religious dietary restrictions, as it is lactose-free, gluten-free, tartrazine-free, and certified kosher. Kosher for Passover and halal.
So how do I help my friends when they come to me and they tell me that they have morning sickness?
Well, it's very important to be supportive. It's very important to let them know that morning sickness is a real medical condition that requires timely treatment. Any woman suffering from morning sickness should tell her healthcare professional right away. Her healthcare provider will likely recommend diet and lifestyle changes to try to get her symptoms under control. However, if diet and lifestyle changes don't work, there's no reason for her to suffer when safe and effective medication exists. At that point, she should ask her healthcare provider if Bonjesta is right for her.
So obviously I Google a little bit too much, more than I should, because it makes my mind wander a bit, but I did find a lot of helpful information on Bonjesta's website, bonjesta.com.
Yes, that's a great website as well, and it's helpful for professionals too to turn to.
Okay, well, thank you for answering my questions. I know I've had a lot of them, but I really appreciate you prescribing something that's safe and effective for me and my baby, and I'm really glad that I feel better, and I'm excited to have this baby boy come out, and you are an awesome doctor, so thank you.
Thank you, and it's great that we found a solution to some of the problems you had in the beginning of the pregnancy, and you're looking better and better every time.
Yay.
Bonjesta is a prescription medicine used to treat nausea and vomiting of pregnancy in women who have not improved with change in diet or other non-medicine treatments. It is not known if Bonjesta is safe and effective in women with severe nausea and vomiting of pregnancy, a condition called hyperemesis gravidarum. Women with this condition may need to be hospitalized. Bonjesta is intended for use in pregnant women. It is not known if Bonjesta is safe and effective in children under 18 years of age. Do not take Bonjesta if you are allergic to doxylamine succinate, other ethanolamine derivative antihistamines, pyridoxine hydrochloride, or any of the ingredients in Bonjesta. Please refer to the patient information leaflet for the complete list of ingredients. Take monoamine oxidase inhibitors, MAOIs. Ask your healthcare provider or pharmacist if you are not sure if you take an MAOI, including Marplan, Nardil, Emsam, Eldepril, Zelapar, and Parnate. Before taking Bonjesta, tell your healthcare provider about all of your medical conditions, including if you have asthma, have eye problems called increased intraocular pressure or narrow-angle glaucoma, have a stomach problem called stenosing peptic ulcer or pyloroduodenal obstruction, have a bladder problem called urinary bladder neck obstruction, are breastfeeding or plan to breastfeed. Bonjesta can pass into your breast milk and may harm your baby. You should not breastfeed while using Bonjesta. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should you take Bonjesta? Talk to your healthcare provider about how much Bonjesta to take and when to take it. Take Bonjesta every day as prescribed by your healthcare provider. Do not stop taking Bonjesta without talking to your healthcare provider first. Do not take more than 2 tablets, one in the morning and one at bedtime each day. Take Bonjesta on an empty stomach with a glass of water. Take Bonjesta tablets whole. If you take too much Bonjesta, overdose, you may have the following symptoms: restlessness, dry mouth, the pupils of your eyes become larger, dilated, sleepiness, dizziness, confusion, fast heart rate, seizures, muscle pain or weakness, urination changes, and buildup of fluid in the body. If you have these symptoms and they are severe, they may lead to death. If you take too much Bonjesta, call your Poison Control Center at 1-800-222-1222. What are the possible side effects of Bonjesta? The most common side effect of Bonjesta is drowsiness. Do not drive, operate heavy machinery, or do other activities that need your full attention unless your healthcare provider says that you may do so. Do not drink alcohol or take other CNS depressants such as cough and cold medicines, certain pain medicines, and medicines that help you sleep while you take Bonjesta. Severe drowsiness can happen or become worse, causing falls or accidents. Bonjesta may cause an incorrect positive result for urine drug screening tests for methadone, opiates, and PCP. These are not all the possible side effects of Bonjesta. Call your doctor for medical advice about side effects. Keep Bonjesta and all medicines out of the reach of children. Carefully read the storage instructions as detailed in the Bonjesta patient information leaflet. Duchesnay USA encourages you to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.